Thank you so much for joining Dental Marketing Theory, a podcast by Gary Bird. In today's episode, Gary talks with Dr. Bill Piskorowski, Health Sciences Clinical Professor, Associate Dean for Community-Based Clinical Education of UCLA School of Dentistry. Dr. P and Gary chat about how a mistake landed him in the dental industry and why we throw our dental students to the wolves. As always, please make sure to like, subscribe, share, and leave a comment, as all of those things really help to get the word out about dental marketing theory. Hope you enjoy today's show.
All right, Dr. Bill, good to have you. Thanks so much. We are live.
Nice to be here, Gary. Thank you. Happy New Year.
Yes, absolutely. Happy New Year to you as well. So you're in Michigan right now, right?
Correct. Visiting
so
family
not
and friends.
In sunny California.
I'm in cold and sunny Michigan right now.
That's awesome. Yeah, so one thing that we've been doing on our podcast when we get started, and it's been really, really popular, and I love your story, is we talk about our dental origin story, and I'd love for you to share with the audience how you got into dentistry. I know you started with your mom and your 17 cavities and that story. So would you mind sharing that with us?
Sure. I'm first generation Polish. My parents immigrated here to the U.S. after World War II, and they were in a forced labor camp, and they came to a community that was basically Polish background, and going to the dentist was not a routine procedure for our family. And I went at the age of 17, and the dentist I went to happened to be a member of the Polish community, and but born in the United States, and a very giving man. And his name was Dr. Stan Tulak. And he says, well, I got some information for you. He goes, you've got one cavity for every age of your life. So I had 17 cavities, and he probably took care of me. And he allowed me to work out the debt in his office, and the debt was $1 a tooth. So he was a very giving man. I was very involved with the Rotary Club International, and from him I learned what it was to be a professional, and I took a liking to his profession, and he took a liking to me. And consequently, I rented a room from him right after graduation and started my own practice with him. So I wasn't an associate, I just rented space. And quite frankly, the whole purpose of what I'm doing here today is to shorten the learning curves of our students, because as I tell them the story, I worked for an idiot the first 4 years after graduation, and that idiot was me. And I had no business running my own office at that point, and probably bit off more than I could handle. And the rest is history, you know.
Awesome. Yeah. And I love that quote, because I was definitely my worst boss that I ever had as well, especially when I got started. So that's a good one. And tell me a little bit about the area that you practiced in.
So I lived worked in an area north of Detroit, which for some would call it a Polish ghetto, okay, where there were a lot of immigrants that migrated to this area. And so I went back to my community after dental school at Loyola in Chicago, and started a practice. And basically, I'd say 80% of my practice base was Polish-speaking immigrants and families that preferred to speak Polish. And there was a great need to be fulfilled here, and that's kind of where I found myself.
And what were some of the struggles that you went through serving in that kind of community?
Well, basically went back to the community that raised me. And I will share with you is that my business acumen was very poor. Okay. And I did okay in dental school. My clinical skills were pretty good. But as we found out that I lacked leadership skills, I lacked the ability to be a CEO of a company. And then I enrolled in a practice management scenario that taught me how to look at data, and I never looked back. And that was very important.
Wow.
And, I share the story with you is that we expect our dental students to graduate as competent clinicians and potential practice managers all at the same time. But if you really understand that in 4 years, a dental student is trying to learn a foreign language and to its excellence. And I have to tell you, then top it off with another bit of practice management and business acumen. That's a lot for everybody to swallow in a 4-year period of time. And that's why opening up our program now with community-based clinical education, I'm making our students aware of a lot of non-traditional paths after graduation. And that gives them the confidence to go forward, understanding what their needs and strengths are based upon their experiences while in dental school.
I love that, and we're definitely going to dive into that. Now, how did you go from owning a practice to getting into education?
Totally a mistake. I used to be a clinical consultant for a group called the Dental Advisor out of Ann Arbor. And the editor was a clinical teacher, and he was 30 years my senior, and his name was Dr. Bill Gregory. And Bill was just an icon at University of Michigan School of Dentistry, well-loved. And he says, I like the way you review our products. I think you should come and teach a day a week at the dental school. And I said, Bill, I really have no desire to do that. And he goes, why? I said, I fly fish on my day off, and I really love the mental clarity there. And he says, let's try it. And I did one day a week, and then I went to 2 days a week, fell in love with it. And then an opening came up to be the director of community-based clinical education at University of Michigan. And I was asked to compete for the internal search and was awarded that opportunity. And now I said to the dean, so what does this actually mean? And so he goes, we're sending our students out into the field, and we really need to make sure that they get experiences in the real world. And I have to tell you that the first model was with the public health entity. And soon after that I was awarded that position, we lost the grant that basically guaranteed our student travel and involvement in clinics outside the area. And we were very much in jeopardy of losing the program. And I said, so why don't we do something different? He goes, what's that? I said, why don't we ask our sites to help us with cost offset or revenue sharing model, instead of relying on grants all the time. And he says, no, nobody's going to pay us to send our students. And I said, our data suggests that we should be getting paid because our students are offering a return on investment, not to mention
You're talking like a business owner now, not an educator, right? You're talking like a business owner, not an educator there.
Yeah, and this is where the challenge came, is introducing a business model into an academic institution. And that is, I can't say it was frowned upon, but it wasn't really embraced at the beginning, right?
Yeah, definitely. And let's dive into that. I know the community-based clinical education, and I want you to kind of dive into that because not everybody fully understands it. And one of the ways that you put it is, why do we throw dental students to the wolves?
Yeah.
And so I would love for you to walk through that. What is it? What are you doing? And how it brings impact?
So why do we throw dental students to the wolves? And I share with you that was a webcast that we did for the American Dental Education Association, and also a presentation during one of the annual sessions for IDEA. And I have to share with you is that a lot of schools do send their students to rotations. Some are observational, some are providing services, but there's very little accountability, in my opinion, and it could be better. And that's what we thrive on, is we assess and account for everything. And we also manage data. And this is so important that we have systems in place. We review the clinics, the doctors, they in turn review our students. We look at what our strengths and weaknesses through the eyes of our doctors in the field are. And we actually change how we teach at the dental school based upon our students' performances. And so having said that, when I started at University of Michigan, I inherited 3 clinics with 6 doctors and 1 practice model, and that was public health. And that was the Federally Qualified Health Center. And at that time, only 1.7% of graduates were going into public health after graduation. When I left in 2017 to start at UCLA, my final graduating class at U of M, 22% of the graduating class went into public health, 10 times the national average. And I have to tell you, what I found out was, if we have good mentorship and a good organization, that students will aspire to that model. And that was only one of 5 different models that we had. And we had models that were supported by state and local health departments. We also had models by tribal communities, correctional facilities, and dental and private practices that had philanthropic nature that they gave back to the community. And we were not allowed at that point to go after the DSO market. And then when I switched over from U of M and went to UCLA, the new dean there was a department chair at U of M who says, I'm bringing the dental school to the community. He had me with those words. And I said, so all options are on the table. He goes, Bill, we got 20 million people here in Southern California. And whatever we implement, it just has to be ethical and quality. Okay. And so he allowed me to investigate now the dental service organization as a model. And it's a significant portion of our student experience now. We have relationships with 6 DSOs, and 13 are now actually exploring the option with us as well, looking into it.
So that's amazing. So walk me through, for somebody like myself, if I'm thinking about becoming a dental student, what's the difference about coming through a program like what you're explaining that you run at UCLA or what you run in Michigan, and what I may experience somewhere else? What's the difference?
So the difference is the following. Could I say to you that before I tackle an assignment with a dental school, or if I look at what a dental school is graduating, I look at the graduating profile of an entire class. How many restorative procedures did they do? How many surgical procedures did they do? How many preventative procedures? What was the experience like during that 4-year curriculum? And I have to tell you, in both universities that we went to, we literally have doubled the graduating class prior to the invention of CBCE, or community-based clinical education. So now I'm going to share with you, you're going to go to a dental school, and I tell you that you'll be offered the ability to do twice as many procedures in the same period of time under the same dollar value. Where would you prefer to go? Under licensed professionals. So, I will share with you that in a very short period of time at UCLA, in 2.5 years, we have doubled the graduating profile in restorative dentistry. We have tripled the surgical experiences, and we have increased the root canals by 70%. So, wow. And I'm still not happy, Gary. We still could do better, and we will do better. We're going to add probably another 30 to 40%. And I will share with you that it's going to not be uncommon for us to treat around 20,000 patients annually just through CBCE and at external locations at one school.
So when and again, for the layman out there, so if I'm going to dental school, I'm going to get more opportunities under trained professionals, but these are in actual businesses. This isn't just like people coming through the dental school, right? These are in other people's businesses that are operating and successful, right?
Correct. So we review our clinics. So right now, my model consists of private practices that do give back, donated service programs, pediatric programs, 6 DSOs, 1 mobile platform, several FQHCs, federally qualified health centers, and a lot of donated private practices that give back to their community. And I have to tell you, our students are really enhancing their educational experience while increasing access to care for vulnerable populations. And that is our mission statement. And I have to share with you that our partners are doing amazing work. Matter of fact, I will share with you that the DSO market stepped up during this pandemic, and they became the safety net solution for a lot of communities. And they're embracing what we have to offer. And again, is it all roses? No, there's the trials and tribulations. So we enter into a contractual agreement. I offer a minimum of 40 weeks for student participation. It's usually 3 weeks at a time, soon to be 4, hopefully, once I get permission from the curriculum to expand. And then we grow the program. And I have to tell you that our students are 0.7 as effective as the attending in general practice dentistry, meaning restorative, exodontia, and primary care for pain management. So the question now becomes, if we're 0.7 as effective as the attending, and I'm charging you literally 1/4 of what it is for a full-time FTE, and you get recruitment and retention with a working interview, and you're protected just as you are a faculty at school, I see very little risk on the participants' side to come on board. Yeah. Plus, we train and we give advice on how to be a good teaching dentist, because it's not 100% supervision. The student earns independence according to the dialogues and the performance as seen on day 1, 2, and 3. Okay, so we adjust our schedules. And, once the doctors become a little bit more comfortable, I will share with you, it's all systems go, and they generally enjoy it. So that program, I started with 3 clinics in Michigan. I wound up with 39, and I started with 6 doctors. I wound up with 117. It's 6 different models. So I have to share with you that we couldn't have expanded if we were not being productive and predictable with our approach.
I love that. And then the students getting real life experience, not just in dentistry, but in business, in building relationships, like you can't really put a number on that, right? Like that's something that's super valuable.
We are opening our students' eyes to non-traditional practice opportunities. But the DSO is actually becoming a traditional opportunity now with over 30%. But why not experience from the best? And you know what? Our students are test driving some of these DSOs. Some like them, some don't. That's great. I'd rather they find out before graduation. And look at it from this standpoint, Gary. How many students are hired immediately after graduation by a DSO and they know nothing about them other than maybe flying them into town, for a weekend seminar or a lunch and learn with pizza parties at school? This is real life stuff. So now we're offering DSOs to come explain their model along with private practices. We're not just selecting DSOs. I welcome all practice opportunities, group practices, tribal practices, correctional facilities, mobile platforms.
Everything.
If you got something to share, come on and share and let our students select, because at the end of the day, I just want to graduate a better professional.
That is so awesome. I love that. Yeah. And I'll be honest with you. A lot of people think, okay, well, why isn't the dental schools teaching the dental students about business? And I'm sitting here looking at it going, I don't know if the school is the best place to learn the business. I don't see that as the best option in the whole world. There's lots of real life examples that you can learn. And right now, teaching business is tough for a college, because a college environment is usually pretty static. And the world of business is moving so fast because of technology now that you get on that treadmill, you better not fall, right? So I love this, that I think it's really the best of both worlds and really answers a lot of these questions. But I have some specific questions for you that I would just love your thoughts on, and we'll crank these out. So, and I'll add this as well. You actually I work with a DSO, a decent sized DSO, and they're working with you and they love it. Like, they are literally raving about it, texting me regularly. Like, this is the best thing ever. We need this all across the United States. I wish I had it when I was in school. So from what I've seen of it, this is not just something that's smoke and mirrors or something just slightly a different way of doing it. This is changing the model of what we understand from a dental school.
Yes. And I have to tell you, we have now working with 6 different DSOs, and I have to share with you that they are choosing their clinics wisely and the doctors wisely. Some DSOs are picking the dentists within their group that have won some sort of mentorship award. Okay. So choose wisely, because our students will tell the world tomorrow about your organization. Okay. And I have to share with you is that, when we're offering a return on investment from a financial standpoint of a minimum of 3 and up to 8.9 after all costs, I will say to you, come one, come all, come experience it, because it's good for some and not so good for others. But you know what? Until you try it and embrace it, I will share with you, we've opened the eyes of our students to a lot of opportunities. In fact, our residents are now going to certain DSOs, and even our faculty, because we do clinical profiles on the clinics. And if a certain clinic may not be doing as many exodontias or root canals, we'll ask them, would you like our faculty to come and train your faculty, okay, or your doctors to be more proficient if they wish? We're a guest in their house. So we look at all the data and we say, why are we doing so many of these more at this site as this site? And it's usually because of the competence of the teaching dentist. Okay.
Yeah, that's a great
point.
So,
there's so many different things through telemedicine, telehealth, teleeducation.
So you're able to leverage. So if I'm working with you, if I'm a dentist, I just want to make sure everybody understands this. So if I'm a dentist and I decide to work with you and you send students to me and I'm teaching them dentistry and I'm saying do A, B, and C treatment, you're going to look at all that data because you have to, right? You need to know what's going on. But then you're going to compare it to everybody else. And you're going to go, hey, you're not doing any of these treatments. And in our expertise from the data, at least 20% of the people you're seeing are going to need this kind of treatment. And then maybe it's something I'm not seeing as a clinician, right?
Correct. So, when I look at a practice profile, we have our own IT system and we record what our students do. We record ICD-10 codes, CDT codes. So we make sure that the health history matches the procedure. Okay. So the diagnosis matches the procedure. And that's one of our protective mechanisms. So if we find out that these are the top 20 medical conditions that our students experience in the real world, we're going to teach that backwards and forwards with all the associated medicaments. So our students are very confident in that area. We also look at the ages across all stages. Do we give our students enough experience under 18? Do we give them enough experience over 65? So I try to cater to those events as well and develop those programs. And we also develop our own programs for like victims of human trafficking and disabled veterans, where we go into communities and help them the best we can with champions in the community that want to give back. And we just logarithmically multiply their effort by offering student participation.
That's awesome. I love that. So a question for you. So when you went to school, dental school, there was no choice. You came out and you were an entrepreneur, right? Like that was the way that it was. And it was the school of hard knocks. There was nobody there to help you. Now today, there's lots of options, right? I can be an entrepreneur. I can be work for a dentist for a short period of time and then become an entrepreneur. I can go to a DSO and make it a career. I can go and partner with somebody and work for them for a time, and then they give me some equity. There's lots of options. What are the younger people in school right now gravitating towards, from your opinion?
So prior to the development of CBCE at UCLA, many were going into specialties and extra programs like residencies and GPRs because they wanted more confidence. What we have found is that 86% of every graduating class values this program as one of the most valuable experiences in their dental education. And I had the same outcomes at U of M. So what is happening is they are now giving an opportunity to test drive certain scenarios, and their confidence level is being built. And we assess them on 13 parameters of clinical proficiency. And if they're true to themselves and they listen to the preceptors, we then match their pre-assessment with their post-assessment of their own self-assessment, and then we match it to the doctor's assessment, and we hope that the sweet spot is somewhere in between those two lines, okay? Mm-hmm. And then that student has very authentic information on strengths and weaknesses that they come bearing. And I have to tell you,
when they're coming in, just so I want to repeat this back to make sure I'm understanding it. So when they're coming in and they're getting, a normal dental school situation, they're lacking confidence.
Absolutely.
And that kills the entrepreneur dream right away, right? Like if you lack confidence, then good luck trying to start a business. So you're solving that through this program. Then once that's there, are dentists more entrepreneur minded right now once they get that confidence, or are they wanting to be part of something greater and bigger than themselves?
Yeah, so I have to tell you what's really amazing is that with one of our DSOs over a 2.5-year period of time, in a very humble point, because they only took some students a couple times a year, but in the first phase, in the first 7 students, they hired 3 of our students out of 7, okay? 2 were earmarked for what they call leadership programs within their organization. But let me tell you the significance of word of mouth. From 2009 to today, 69 students were recruited to work at this one DSO. However, 30 of those 69 were done in the last 2.5 years while we had the program, and we only rotated 10 students through that program because it was word of mouth by their colleagues and their fellow students saying, what a great organization, what a great experience. And now they compete to go to these sites, okay? Because we're sending our students within California and across the country, and soon to go international as well to do more philanthropic work. But again, we're just opening eyes.
Okay, so you're in the middle somewhere. Some want to be entrepreneurs, some want to be part
Absolutely.
of the organization.
You know what?
Okay.
Some people want to just provide service, which is fine. Okay, and that's okay. Not everybody needs to be an entrepreneur. Okay, and some want to work 3 days a week. Some want to work 5. All I know is most people don't want to work 5 8s. They'd rather work 4 10s. And the model that's really kicking the streets alive right now are 3 12s. Okay.
Okay.
And quite frankly, there's something and some mechanism there for everyone.
That's awesome. All right. So here's some specific questions for you. So love your model, but there's still some like real world problems to sort through, right? So right now, someone's going to dental school. It's $300,000 of debt when they're done. I actually just had an interview with someone from Heartland Dental came out of dental school, in day one they had like, it was like $400,000 in debt. So if you were a dental student today, day one coming out of dental school, you got $400,000 in debt, what would you do?
Well, there's several approaches that you can take. Okay, and again, it all relies on family matters, what your own personal goals and aspirations are. But what I'll share with you right now is there are ways of solving $300,000 worth of debt relatively quickly. There are a lot of public health clinics that will give loan forgiveness if you work for 5 years through the Health Service Administration Act. If you go into the military, you can wipe that out as well. Those are two things. There are some DSOs that are actually offering bonus checks for signing on. But I will tell you, when you're guaranteed an income with a DSO right from day one, you can pay down that debt if you're earnest about it. Okay, and a lot of things I'll tell you is that a lot of our students have failed in practice management when they accumulated debt during dental school because they felt that this is a platinum MasterCard that they could just rack up. Okay. I mean, I used to go to the amusement park, on my spring breaks. Okay. And they're going to Rome and Paris and Italy, on their spring breaks. Okay. So, there's a little bit, how do you say it, of fluff in that dollar value as well. But there's ways of paying that back. And I have to tell you that it's more about creating the perfect opportunity and not to have the struggle in being productive right out of graduation. So if you are aligning yourself with a DSO or a public health clinic, I have to tell you, you can pay down that debt in no time, nor should anyone ever consider not going into medical or dental school because of the impinging debt. My own daughter is graduating from veterinary medicine school this year, and I have to tell you, she totally embraced it, and there's opportunities for her to pay back her loans. And quite frankly, there are ways. And all you have to do is have that energy and passion to do what you were intending to do. And like I said, some want to own their own clinics, but some just want to practice dentistry and get the paycheck and do a nice job and walk out, which is fine.
Lots of great options there. All right, I love that. All right, so because I've never been to dental school, right, I went out and posted on Facebook and said, hey, give me some questions that you would ask the dean of UCLA, the associate dean of UCLA. And so these are some questions that I got here, and we're going to tag these people in these and split these apart. So one of them was, what's the main mission of the dental school? What is your main mission as a dental school?
The main mission of the dental school is to make sure that we are providing an entrusted professional upon graduation. Okay. Also to not only solve it from providing professionals, but to do the research associated to make the lives of our patients better through evidence-based practice. So from that standpoint, we are entrusted to guarantee that we are graduating competent professionals.
Awesome. This one actually came from Dee Fisher. She's a consultant and been in the dental industry forever. And she said, do you feel that dentists are equipped for business when they graduate? And if not, what are their next appropriate steps to get to where they need to go?
Do I feel that they're prepared? Is that the question? I'm sorry, you broke up.
Yeah, for business. She's more approaching it from the business side. So if dentists are dentists graduating prepared for the business side of dentistry?
I will share with you that depending on the student, again, some embrace it. Some even come into school with a master's in business beforehand, dual degrees. Those are easier because they get the concept. But I will share with you, since the CBCE program, for those that truly embrace the rotation, they learn more about the business. But as a general rule of thumb, I will share with you that we are not doing an adequate job in teaching the business platform, because there's so many different platforms. Do you want to do public health? Do you want to do DSO? Do you want to do third-party payer? Do you want to be a private practitioner that accepts no assurances? I'm saying to you is that there's tribal communities, and now we're enlightening them to this deal. So it's kind of like, where do you want to go and how do you want to learn this? And we are giving them that opportunity. And it is our mission to increase that value. And now we're even, engaging in exploration of doing selectives to make students that are willing to become entrepreneurs or more business savvy, that they'll have that opportunity to do that. And that's why we select the students that go into these DSOs and these other clinics to understand the model before they go.
Perfect. Okay, that's really good. Okay, this one is from Eric Roman. He's actually a dentist. He founded, and grew a big practice in multiple locations, and now he's more of a consultant. And he had two questions: what's changing about your students, and what is the school doing to adapt to that?
You know what? Education is always adapting towards the needs of the students. Okay. And number one is I don't ever want to engage new programs for our students that are going to cost them more money, because there are platforms out there that we could do this and make it better for them. But I will share with you that with the advent of community-based clinical education, there are 67 dental schools plus and more being created. And I have to share with you is that we need to take it upon ourselves to create opportunities and make sure our students are engaged in communities, to understand what it is to be a professional and the reason why they became a professional. So one of the things I'll tell you, Gary, is they all come in with high aspirations of making a good living and giving back to their communities. And then we beat the hell out of them for 2 years with all these courses and just pound on them. And they forgot why they're there. And this program is actually bringing them back into the reality of why they chose to be a health professional. And they always say to me, Dr. P, I can't thank you enough for allowing this opportunity, because now I know why I came here to begin with, okay? Because they kind of lost that in just trying to keep up. So we are listening to the students and what their needs are, and they want to get as much experience as possible before they graduate, and they want that confidence. And this program is actually doing that for them.
Great. That's great. Okay. This one is from Dr. Paul Goodman. So he's a dentist. I believe he's on the East Coast.
Yep.
Very, very critical of dental colleges. He's one of the nicest guys in the world. So he does it very nicely and lovingly. And so I'm actually going to take this and drop this particular one into his group, because they have a very select opinion about dental schools and what they should be doing and what they shouldn't be doing. And some of the views are spot on. Some of them, obviously, some would disagree with. But here's his question. He says, patients will always have trust issues with that they don't understand. Where do you think dentists have the biggest opportunity to build out their communication skills?
By being ethical from the get-go. Okay. So I will, that's a great question. Now, one of the things I share with you is this. I have a patient at a DSO that says, why should I have my services being done by a fourth-year extern, is what we call them, versus the attending? And then I say to them the following, that this person is going to be able to call me Bill upon graduation. So once you get your license is every bit as good as mine. So the trust issue becomes the following. We review these clinics where our students go. All right. It's through these assessments that we know if this organization is where we need it to be. And I have dropped DSOs. I have dropped private practices. I have dropped faculty from my program, as well as giving pats on the back for people doing it right. So I just want to share with you, we're finding the best and the brightest to be part of this organization. Now, when we put the UCLA brand on one of the clinics we come on board, is because we evaluated them from a 3-month period of time. And I want our clinics to say, we're in affiliation with UCLA School of Dentistry or the University of Michigan School of Dentistry. And we are honored to be selected by this school to be part of their growth and development of the future professionals. So it's all about creating this ethical mantra. And I have to tell you, I learned something from my own father. He says, Bill, you never seem to have enough time to do things right, but you always seem to have enough time to do things over. Okay? So just do it right the first time and solve your problems. Okay? So I just want to share with you is that we are trying to teach these ethical principles. I have to tell you, we are always looking at what it means to be an entrusted professional in our community. And mind you, if a student comes back because of poor attitude at one of our sites, they don't want to have a coming to Jesus meeting with me. I don't have time for that.
That's awesome. I love that. All right. So Dr. Matt Bennett, Dr. Damon Thompson, he's a dentist. I think he has a couple locations. And he said, it feels like all the and I'll kind of phrase this too, because I've seen this as well. It feels like a lot of the bigger DSOs get a lot of the opportunity at the dental schools to work with dental students. So sponsoring events, working with the students. So DSOs have figured out, hey, we're going to start working with these dental students year one, so they know us by year 4 or 5 or whatever, and then they get the opportunity at them at those students. So he said, how can somebody smaller like himself get an opportunity with a dental school?
I have to tell you that in my eyes, we create, whether you have 1,000 clinics or one clinic, you're all equal in my eyes. And I have to share with you is that if a private practitioner wants to open up, which I've done, single practices and engaged our students through those practices, we can absolutely rotate students through private practices, whether they're one practice or 100 practices. They have the same opportunity. All they have to do is contact the dental school and say, you know what, I'd like to talk about practice management, maybe at a lunch and learn. Because a lot of these major DSOs, they're coming and throwing pizza parties and whatnot. But you know what, in reality, that gets their name out there, but it really doesn't bring the student into that cluster. But if a private practice wants to associate with a local dental school, I have to tell you, for the most part, they'll embrace that in a discussion to come forward.
I love that. How would you do that? So if you were a dentist today and you were trying to grow your organization, you had maybe 2 locations, let's just say in Nebraska, right? How would you go about getting your foot in the door with a dental school?
Well, number one, with myself or schools that I know of our model. So University of Washington, University of Michigan, UCLA now, Oklahoma to a certain extent, and a couple others that are embracing parts of the template. If those are in the States, if they want to contact me, I could put you in contact with the dental school in your area. Or if you want to work through us, because my entire goal in this is to centralize the process of engaging our students. Meaning, let's create one platform. And since I have the ear of several DSOs and alike, I would love to entertain dental schools from different states to participate in locations with our students, because if one school is doing it better than the other, I want to know why. So this is a healthy competition, and we need to be able to do that. So if you want to put it out there, you can have my contact information. I can give anyone that's interested some information about how to go about this process. But that's the entire thing that we're doing. So the first thing is you create an affiliation agreement with the dental school, and then we look at state and Commission on Dental Accreditation guidelines to make sure that we are able to do this. There's only a handful of states where it becomes a little bit more difficult. And then we can start a process of rotations, okay? We always start with a pilot program, and we look at the affiliation agreements, but then you look at the doctors that you want to be involved with here, because we have to credential them as faculty, and that takes about 2 to 3 months to get through all the paperwork. And then after that, we let the process go.
That's awesome. Yeah, I'll make sure in all the videos that we release, your information is going to be right down below in the description. So we'll make sure everybody can reach out to you. All right. So what is the most impactful marketing campaign that you've ever had on your life?
The most impactful marketing campaign on my life.
You said it was something to do with the big house.
You know what? I have to share with you is that I am a Michigan football fanatic, right? And
is that allowed when you're at UCLA? Do they let that, or you have to keep that under wraps?
Oh, you know what? I have to tell you that all universities should embrace, what they come from. But my marketing campaign started when I was 6 years of age, okay, where a friend's mother used to take me to the Michigan-Ohio State football game every year since age 6. So, you're talking about being ingrained, and with that becomes somewhat of an honor code. So you would hope that UCLA, a very recognized brand, U of M, a very recognized brand, when we associate this with our opportunities, we should be, it should not hurt any opportunity or affiliation with those that we affiliate with. So from a branding standpoint, I have to tell you, these are some of the intangibles that do work, because if we put our name on a building, that means we vetted the process, okay? And that's how I look at the Michigan opportunity. You know what? All schools have their strengths and weaknesses. But at the same token, I just want to share with you, I'm very beholden to both University of Michigan and UCLA for giving me the opportunity to expand this model, because in the end, I just want to shorten the learning curve and increase access to care. Okay. And with that having said, I think we're very well on that mission, because our school right now is doing about $6 million worth of service annually. And I hope to make that 15 to 20 million annually. So I just want to tell you that this is going to be something that our students are very proud. And when you graduate from these institutions that go into the communities, that you're going to hold your degree up high and say, you know what, I graduated from that, and they're really making a difference in the lives of other people.
I love that. I love that. Well, thank you so much for coming on today. You did a great job explaining this and answering those questions. I can't wait to get this out here. And when you come to California, I owe you a coffee. So I'm going to catch up with you and sit down and have a coffee with you. All right.
We'll be there in the next couple of weeks. All right. Thanks, Gary. And I'm looking forward to meeting your constituents when needed. Okay.
Awesome. Thank you.